When we talk about facial fillers, we first think of the hyaluronic acids, and we have two choices, Juvederm or Restylane. Hyaluronic acid sounds like something foreign, but actually it's in all of our cells already, and so the chance of an allergic reaction is very, very, very low. These soft tissue fillers are injected in the office here under simple injection with or without a little topical medicine so it doesn't hurt the patient at all. And the new advance is that both of these also contain a local anesthetic in them so that as we inject it even numbs up the area further. So there's not a question of patient discomfort, even in the lips that are probably the most sensitive area. We can inject these wherever there is a soft tissue fold or a fine line that we would like to fill out on the face. A second-line facial filler is called Radiesse. Technically, it's calcium hydroxyl apatite. This is a thicker material that we don't use for very, very fine lines, but is one we use more for deep folds, such as between the nose and the mouth or the corners of the mouth. Additionally, sometimes we'll use this as a volume replacement in the cheeks. In order to make the patient comfortable prior to an injection of Radiesse, we first use a topical anesthetic on the face for about 20 minutes to create a numb feeling. If the area is also particularly sensitive, we can inject a local anesthetic in the area to form a block so there's even more numbness. And additionally, when we prepare the Radiesse in the syringe, we mix it with a little local anesthetic. So we have three different methods of helping to assure that the patient has a comfortable experience as they're getting their folds filled out. The third type of facial filler is called Sculptra, which is poly-L-lactic acid. This is the same formulation that's actually in some sutures that we use in surgery. It was discovered that poly-L-lactic acid actually stimulates the person's own collagen to create a fullness in the soft tissue. This is different than the other fillers, which actually fill the tissue out. This poly-L-lactic acid, or Sculptra, encourages the body, stimulates the body to create its own collagen and make its own correction. For that reason, it's different than the other two fillers that we have, in that this is done in a series of 3 injections, not just one. And so we do one injection 1 month, we then space another injection approximately another month later, and then a third. And what happens is that with each injection, we're seeding the soft tissue. It's like putting grass seeds in a lawn. We see a little bit of growth the first time, not very much. Then after we do the second injection, we see a little bit more growth. And by the third injection, we really see the face start to fill out. This is the kind of injection that's used for volume replacement, especially in the cheeks. As people age, sometimes they lose fat in the face, and they get a hollow look in the cheeks, which gives them a gaunt look. We also see this in young people who are in great shape, such as runners or personal trainers. So rather than have a face that looks hollow or gaunt or unhealthy, because sometimes our faces lose volume when we get sick, we can return someone's face to a more rounded, full, healthy appearing face by the use of Sculptra. Sculptra is done in 3 different sessions, 1 month, 2 months, 3 months, and then we wait and watch. And it is just amazing to see that between the 4th month and the 10th month, the face continues to fill out, and we have a very natural correction that we see. And it's very, very subtle also as it starts to move along. But when we compare the pictures to before there's an injection at all and a 10-month result, it's a magnificent rejuvenation look.